Hi again. Today we are going to discuss about a very important person in our life. We are going to talk about the person who ensures to take care of our health. What do you do when you have stomach ache or when you have fever or when you have some body pain? Where does your mama take you? Your mama takes you to the correct doctor. So today we are going to talk about the community helper, a doctor. A doctor generally works in the hospital or clinic. What is the new word you're going to learn today? Hospital, clinic. Okay, so that is his workplace. That is where the doctor sits and he examines the patient. Patient is another new word you're learning today. Patient is a person who is having some physical pain or illness. Who is a patient? A patient is a person who is having some health problem. A doctor is a person who heals the patient. And the doctor generally has people around him who help him in his work. One such person is the nurse. The nurse assists the doctor in giving injections or while operating or doing anything what the doctor requires to do. He requires some help, right? So, the nurse is the person who assists the doctor, who helps the doctor. Then there is another person who helps the doctor, and that person is called as compounder. What is that person called? Compounder. Compounder is one person who helps the doctor to take the entry of the patients, to note down the names of the patients, to ensure that there is cleanliness in the hospital. All these things, who takes care of? The compounder takes care of all these things. Then, there are certain things which the doctor uses. Have you seen something the doctor puts in his ears and there is something which comes like this and then he holds like this and then he puts it and he tells you, come on, breathe in. Then he says, breathe out. Then again you. What is that thing that the doctor holds? The doctor uses a stethoscope. What is that called as? Stethoscope. What is that thing the doctor puts in his ears and listens to your heartbeat? That is called as stethoscope. So a doctor uses stethoscope. He prescribes. Prescribes means what? Gives us. He gives us medicine for us to get well. So he uses medicine to make us well. And also at times he uses injection. Ouch! What does he use? Injection. Whenever required, the doctor pricks an injection for us to get well soon. So these are important things which the doctor uses among many other things what he uses. And one more terminology you need to understand when we talk about the doctor. When there is an emergency, suppose if somebody all of a sudden is not keeping well and has to be rushed to the hospital at the earliest, or maybe there is an accident on the road. Have you heard of a vehicle which makes a pee-paw, 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 pee-paw sound? What is that vehicle? That is ambulance. The doctor uses an ambulance to bring the patients to the hospital. So today, a quick recap of doctor. Doctor is assisted by nurse, compounder. And who comes to the doctor? The patient comes to the doctor. And where does the doctor sit? He sits in the hospital or clinic. And what does the doctor use? He uses medicines, stethoscope, injection, and yes, there is a first aid box also. And then what is the vehicle the doctor sends for the patients? It is the ambulance. And what does the doctor do? The doctor treats the patients. What does the doctor do? The doctor treats the patient. So will you remember all these words? And now, coming to the main part, when the doctor takes care of us, it is our duty to respect the doctor. Whenever you meet any doctor, uncle or auntie, you should wish them good morning or good afternoon or good evening. Ask them, how are you? When you go to the hospital, the doctor asks you, right? How are you? So is it not our duty to ask the doctor, how are you? Who is going to ask them? It's we who have to ask them, right? So next time when you go to the hospital or you meet any doctor on the road or anywhere, you first ask them, how are you, doctor? And thank you so much for taking care of us. Will you do that? Bye-bye.